put the report briefly in a little bit of a wider context, Australia has been unique amongst Western countries in terms of its remoteness, which means that throughout the history of this country, there's been a difficulty for people in rural and remote areas of the country to get access to medical professionals. One of the things that we suspect may be happening is that this is being supplemented by this a wider cultural trend towards self-care, whereby people are actively seeking out information about medical conditions, even in cases where they're under the supervision of a medical practitioner, in order to better take care of themselves, manage health conditions, as well as prevent health conditions. Likewise, search interest in fitness and nutrition and other activities to take care of oneself. Likewise, face a lot of seasonal rises and falls. So, for instance, when it comes to things like the consumption of vegetables, we see that really spikes around the Christmas holidays. And then declines substantially thereafter, whereas fruit, really spikes right after the Christmas holidays. At the same time, though, it's during that same window you find people are not really paying attention to things like fitness. And that really declines in that week when between Christmas and New Year's, when it seems a lot of people are really, taking a holiday from that. It's not that they aren't searching for health things online, because they're certainly looking for fruit, but they aren't so focused on things like fitness. Looking at various chronic conditions, we see that cancers are something that really a lot of people are continually searching for, and those numbers have crept upward steadily. However, in relation to that, it's somewhat remarkable that the number one killer of Australians, heart disease, it does not really seem to occupy much of the Australian public's attention. We have seen some significant increases in various other things, particularly when it comes to trying to find healthier ways to eat. And so people have been really looking at varieties of ways in which they can prepare vegetables. And they've been looking more at specific qualities about fruits. And this is, one of the things that we found that's kind of interesting is that you see transition from, some of these fad topics like concerns about gluten.
Well, Dr. Jensen, thank you for giving us a brief preview into the forum and the report, and we'll hear a lot more detail and an elaboration of the full report on October the 16th in Parliament House.
Well, thank you very much.